All right, good afternoon, everyone. My name is Kileen. I'm a first-year resident at Rush, and this is the THA-10 score predicts conversion to total hip arthroplasty after hip arthroscopy at long-term follow-up. Here are disclosures. So hip arthroscopy has really skyrocketed in the last 2 to 3 decades, specifically for the treatment of femoroacetabular impingement, or FAIS. And with this evolution, we've seen more concentration on things like labral repair and capsular management. And so while this growth is very exciting, it's also a double-edged sword. It can introduce a lot of heterogeneity into our studies looking at long-term outcomes. So at this point in time, our long-term studies are imperfect. But I think more importantly, we are imperfect too. At the time of the study, it was recently reported that up to nearly a third of patients undergoing hip scopes were converting to total hips within 10-year follow-up. So it implied that we have a lot of work to do in terms of improving our indications as well as our surgical technique. Another area of orthopedic research that continues to grow is the development of scoring systems to prognosticate outcomes for patients, to guide treatment, as well as communicate that to them in a way that's easy and digestible for them to understand. And you can see that every single day we have more and more papers coming out. So with that premise, we have 2 main questions which drove the purpose of the study. One, what are predictors of total hip conversion after hip arthroscopy at long-term follow-up using contemporary surgical techniques? So that includes labral repair, hip capsular closure. And 2, can we use these predictors in a clinically useful scoring system to better predict future outcomes for our patients? And we hypothesized that yes, we would be able to achieve these goals. So this was a case control study with the following criteria. These were the variables that we collected, and we compared them between 2 cohorts, essentially total hip converters versus survivors. Any variables that were significantly different between these groups, we retained, and then we weighed them using odds ratios. We then converted the odds ratios to integers to later use in what we would call the THA-10 scoring system. Then we applied this scoring system back to our patients to compare their total hip conversion rate to each patient's individual score. And using these data, we would calculate the threshold score at which a patient would be at most significant risk for a total hip conversion. So this is predictive future outcomes. So in total, we had 280 patients at minimum 8-year and average 10-year follow-up. 7.5% of them had converted to a total hip. On average, our converters were older, they were heavier, they had higher tonus angles and grades pre-op, higher alpha and tonus angles post-op, worse pain scores preoperatively, and more cartilage defects noticed during surgery. Looking at our continuous variables, only age and BMI had an AUC of 0.7 or higher to consider for the scoring system. And in here, you can see those odds ratios being converted into integers to use in the novel THA-10 scoring system. And so when we applied the scoring system back to our patients, we found that it actually performed very well in comparing the total hip conversion rate to each patient's individual score with an AUC of greater than 0.8. And so here's another way to visualize that data. I want to point out 2 main points here. First, when our patients had scores of 2 to 3 and then moved to 4 to 5, the rate of total hip conversion nearly or more than doubled. And you see a similar trend when going from 6-7 to 8-10. We then calculated that a score of at least 4 out of 10 was the most sensitive and specific for predicting the highest risk of total hip conversion. So now we're talking about that future predictive risk with the respective percentages listed below. So it's nearly a 10-fold risk here. And here's another way to visualize that risk data. You can see it's certainly increasing in a nonlinear fashion. So in conclusion, at long-term follow-up using modern hip arthroscopy techniques, the overall total hip conversion rate at 10-year follow-up was 7.5%. These are the variables that we were found to be predictive of total hip conversion. And when we used it in a novel THA-10 scoring system, a score of 4 or more was the threshold at which patients were significantly increased of a risk of total hip conversion. There are limitations to this study. Of course, things like cartilage defects are an intraoperative finding, so that limits the preoperative use of the scoring system. However, we don't believe it necessarily warrants a total discard of the use of this score, as things like BMI, tonus, grade, and age and can still bring you up to 4 points. Here are references, and thank you for your time.